So, Assalamu alaikum, everyone. Welcome to Muslim American Youth Initiative. Today, our Zoom discussion is on breaking barriers. Let's talk on mental health. And our topic for today is anxiety. Um, so, first of all, I would like to welcome my co-host, Dr. Osman for joining me again for the second session. Thank you so much, Osman, for joining in. And moving forward, I think that, anxiety is a very common thing that we all actually go through at some point in our life. Sometimes it's more, sometimes it's less, but we all experience it. And I would like to begin with the definition that I have here on the slide, that it's a feeling of worry, nervousness, unease. One second, because it's actually, you know what, it's covering everything. So feeling of worry, nervousness, or unease, typically about an imminent event or something with an uncertain outcome. And just recently, Texas, our state, actually experienced something which was a crisis situation, and we all went through some very anxiety provoking moments. And then there was actually a lot of damage, loss of life also. And we saw very unpredictable situations, and they were very fearsome. People were very scared about the outcome, uncertainty of everything. So we are going to talk about that also today, in relation to anxiety. And having said that, I think we can delve right into anxiety, what it is, and I would like to invite Dr. Athar to elaborate further on the definition and then give us some more explanation of anxiety.
Thank you, Dr. Hassan. Thank you again for inviting me. I'm very grateful. To start with, I think it's important to have an evolutionary perspective of anxiety in general. So we know that our ancestors lived in hunter-gatherer societies in which it was often the responsibility of some members of a tribe to go out and look for food before the establishment of things like agriculture. So in this setting, there were certain aspects of mental health which were very advantageous, and one of them was to have a sense of anxiety. When our ancestors went out to hunt for game, like deer or what have you, there were also predators that they had to be cautious of. That included other tribes or bears or cheetahs, lions, jaguars, etc., any type of carnivorous animal. So to be able to sense danger and to respond appropriately to danger, as well as to use our bodies to be reactive to danger or unfamiliar situations, is something that we are programmed to do. And it is something that is very important and that helps us in our survival. All of this is to say that anxiety is not something that's always an illness. It is something that we need. So like Dr. Hassan was saying, for me recently here in Mississippi during the ice and snowstorm, I had to drive to go to work about 20 miles away. And during that time when I was on the highway, I did have anxiety. And I think it was important that I did have that anxiety, because if I was completely reckless when driving, then I would likely have gotten into an accident, God forbid. So, to be slow and driving 30 miles an hour on the highway, and to frequently check my surroundings, and to be extremely careful on bridges when there was a lot of ice. These are all things that I knew to do instinctively, and it's all from our evolutionary history. So I think we can go on to the next slide.
So it seems to me that anxiety is something which takes us in our survival mode as well. So in some situation, it's really threatening outside, or that something which is creating some kind of a fear, then this can be our defense mode, actually, that can save us from more hurtful situation or damage. So definitely, I mean, anxiety has its pluses, but I think it's going to be a spectrum, right, where anxiety becomes problem. Yeah.
Right, absolutely. So I guess we can talk a little bit more about model of what happens in our body during anxiety, and this is called the flight, fight, or freeze model. And this is how very primitive areas of our brain make us prime for reaction. So going back to the previous example of like hunting, you know, say for example, you come across a bear, you have three options basically, and each of those options have its risks and benefits that you have to weigh very quickly. So you can, you know, have flight or basically run from the bear. You can fight or choose to battle, or you can freeze or choose to play dead in order for the bear to not notice you. So each of these situations are things that we also do in the modern world to deal with dangerous situations, like what Dr. Hassan was saying, to go into that survival mode. So flight, you know, if you say, for example, are in a dangerous situation, like you are about to be robbed, God forbid, you always have the option to run. You can also try to combat the person who's trying to steal something from you, or you can, you know, freeze if you're in a situation that may be more advantageous for you to do so. I don't know if you had any other comments about this, Dr. Hassan, from your perspective, from a psychological perspective.
No, I think that covers it all. I mean, I know that, you know, this is our innate, you can say, autonomic response, immediate response that we have,
Right.
which is to protect ourselves. And then I think maybe you are going to talk about it, that where we make in the brain, where we make our logical and rational decisions, that takes some time to come into practice, becomes active a little after
Mm-hmm.
a certain time. So this is what is happening. So like we were discussing it, amygdala, which is the first response, and it's immediate response, and it's a fight, flight, freeze response. And you know, and also I would like to mention one thing, that in these responses, that these are like a short duration responses, because they are basically there to give us time to get away from the danger. And mostly it is between 15 to 18 minutes. It's I was reading an article. And also then the frontal cortex comes into the picture, that it takes over, and then we start making more logical and rational decisions. So correct me if I'm wrong.
Exactly. No, that's exactly correct, Dr. Hassan. Very good.
So, and I think
So
that,
for this slide,
yeah, I,
sorry, go ahead.
no,
Go
I
ahead.
was just going to say that I think to understand what's happening in our bodies when we are anxious, so this can explain very well. And go ahead. I mean, you were going to explain the um, react all these
Yeah,
hormones and the chemical, you know, happening.
right. Yeah. So this is part of our hormonal system. So in the brain, like what Dr. Hassan was saying, the amygdala and the hypothalamus are responsible for secreting hormones that increase our stress response. So, example, your amygdala and hypothalamus are activated because your visual cortex communicates that to those parts of the brain, and those parts of the brain.
Hmm. I think, Usman, we lost sound for, hello. Can everyone hear Usman, or it's just me?
Able to come back.
Yeah, she's back now.
Okay. Dr. Hassan, can you hear me?
Farah, can you unmute yourself, please? You are on mute.
Okay. So I was not able to hear Usman, but if everybody was able to do that, then I think we can move forward with that. So, Narjis, were you guys able to hear him? Or
Yes, yes. I told him that we could hear him. Yes.
okay,
Yes.
that's fine. So yes, so we end its recording. So I'm back. So we can go ahead.
Okay, yeah, sure. So I was just discussing, you know, that when you see that danger, your hypothalamus secretes a hormone to get your adrenal glands to secrete the stress hormone, and all those things interact with different parts of your body. So it expands your lungs, so you have more ability to breathe and take deep breaths in order to be aware of danger and to respond to danger. It also takes blood away from your stomach, so it can go to more vital organs and your digestion slows down. It also increases your heart rate, and that's very important. So that's why when we go through stress or feel anxious, we often feel like we're having panic or a heart attack or our heart is racing. This is all part of the stress response. And something that Dr. Hassan and I were discussing before starting this lecture is we both feel that having this knowledge, just the ability to understand the stress response, can help people in the moment to slow down. Like what Dr. Hassan was saying earlier, the amygdala and the hypothalamus, these are very primitive parts of the brain, and it takes minutes, up to 30 minutes for the frontal cortex, which is where you do planning and logical thinking, to really kick in and to make sense of a situation. So the stress hormone does all of these things. It expands your lungs, it increases your heart rate, it diverts blood from the digestive system, it diverts blood from your extremities like your arms and legs, or mainly your hands and feet, to give more blood to your big muscle groups so you can be prepared to run. And that's why a lot of people experience tingling and maybe even numbness when they're very anxious. So all these things are happening because of cortisol, or the stress hormone.
Yes. No, I think that makes a lot of sense, because as we were discussing, that having a better understanding, in-depth understanding of what's happening physiologically within, can help us understand anxiety, and maybe it can help us to cope with anxiety in a more constructive way, because there are some natural responses occurring in our body which we take them as something. We don't understand why the tingling, why suddenly we feel dizzy or something like that, but this is not something to be, you don't have to feel panicked about it, but this is all happening within your body, which is a defense to protect you, to defend you. So moving on, so we come to what are the causes of anxiety, and there are a bunch of them. So there can be environmental factors such as situational, or there can be difficulty at work, in relationships and family issues, or some past trauma, any kind of experience of abuse or something, PTSD, post-traumatic stress disorder. All of these things can perpetuate anxiety, and also then there are genetic factors, there are medical factors, there is brain chemistry, and then there are factors in which people, when they're abusing the illicit substances, drugs, alcohol, and there is a withdrawal, then they feel extreme degree of anxiety. And here I would like, again, Dr. Athar to explain the genetic and the medical and the brain chemistry causes of anxiety a little bit with examples.
Yeah, sure. So the main thing that we know is that there's a chemical in our brain that's responsible for us to feel good and relaxed, and that's serotonin. And we have certain people who have less serotonin, or they're less responsive to serotonin in their brains. So they are genetically more prone to anxiety. And these problems typically run in families. So chances are, if both of your parents, your siblings, suffer from depression or anxiety, then you may also suffer as well. So that's from a genetic perspective. Like Dr. Hassan was saying, there's also medical or hormonal factors which can play a role in anxiety. And basically, that's not related to the genes or the genetic makeup that we have at birth, but things that happen to our body after birth, during our childhood or adulthood, that can make us more prone to anxiety. And these are certain diseases such as thyroid diseases, hypothyroidism or hyperthyroidism, when our body is producing too little or too much thyroid hormone, or even certain other types of diseases which can wreak havoc on our hormonal system, things like a complicated pregnancy or post-pregnancy. The hormonal shifts that women go through can make them very prone to anxiety. There are also many women who suffer because of their menses and the hormonal shifts that they have, and experience depression and anxiety. before their cycle. So there are several problems that we know. There are also people who, when they develop cancer, the cancer is producing chemicals or antibodies itself, which can make people very anxious. And then there are also life events that happen that's related to, being diagnosed with a major illness like COVID or cancer, like I mentioned, in which the psychological factors which the patient or the family go through produces anxiety because it's about the unknown. We don't know much about what's going to happen to us, and that provokes people feeling anxious.
Yeah. So everything that is, creating fear in you and uncertainty is, making you anxious. And if you would also like to talk about, Dr. Atar, the psychological techniques in which I know that this is a vicious cycle, but if you would like to explain that.
Yeah, sure. So basically, we know from a psychological perspective that anxiety is like a negative feedback loop. So anxiety comes about when we have feelings or thoughts that are negative, such as feelings or thoughts related to the unknown. Thoughts could be like, what am I going to do? What if this happens? What if my family leaves me? What if my house collapses, etc.? And those feelings will lead to worry, fear, dread, and that will lead to a certain response in your body, like we talked about, the cortisol response. And those behaviors will be triggered, such as fleeing or fighting or freezing. And what happens in the vicious cycle, the negative feedback loop of anxiety, is that a lot of those behaviors that we have actually make the thoughts and the feelings worse. So when we flee from a situation that can be managed through higher order thinking, like logical thinking, or we freeze or we fight in a situation, that leads to further thoughts and feelings that trigger anxiety. So part of the psychological training that Dr. Hassan is specialized in is to break this vicious cycle and to try to get a client to recognize what stage of the cycle they're in and how to break these negative thought loops. If Dr. Hassan, you would like to explain more.
Yeah, I definitely, because it happened to me recently. And, when this whole situation occurred of the inclement weather that we were undergoing, and we didn't had power, and then we had power, but we were not sure if, for how long we are going to have it, because it was coming and going. And at that particular moment, my husband was going to be on call, and I was still, we had a couple of more nights with freeze warning. So I was by myself at home, and this thought process, this vicious cycle started, that okay, what if this happens, what if that, so what if the pipe bursts, what if the ceiling falls, and what if I am by myself and nobody is available to help. So I was getting in that mode, opening the faucets and closing the faucets, and then trying to see if we have hot water, no hot water, things like that, getting everything together, candles, or the, so if the power goes away. And then I kind of did my own thing, little bit of mindfulness, and then I said, you know what, let me think logically, because I am at home by myself, so that's a given. And if God forbid something happens, then I'll be dealing it myself, so that's a given as well. So what should I do? So I kind of prepared myself that okay, if that happens, then I can have, I can call 911, or our neighbors are like really gem of people. So they just, they're beautiful, wonderful, helpful people. So I was very mindful of them being around, and I can reach out to them, reach out to your friends. So kind of I made a plan for myself. And this is what exactly we do in crisis situations as well, to kind of, if we know we have a warning of certain situation going to be occurring, then we make a plan for it. And this exactly is what I was able to break that vicious cycle, because if I kept on thinking what if, and this what if can lead to a lot of anxiety if it goes unaccounted, and we can't stop that thing. So I think that's a great visual also that we have it here. So moving on to the treatment, I think that this is what everyone is interested, and there are definitely few things which are self-help that you can do once you First of all, you have to figure out the triggers that are making you anxious. So it's very, very important to define and to understand what are the triggers that create these feelings in you. And the first mode that I always suggest is relaxation techniques, and the breathing exercises, the mindfulness, and listening to soothing music, yoga. All these things are there to calm you down and give you that enough time to get over that amygdala hijack. That there is a term, amygdala hijack. I wanted to actually mention it earlier. And it has been coined by Daniel Goleman. His book Emotional Intelligence, which he wrote, has been very, very popular. And amygdala hijack is when certain threatening situation occurs, and immediately your amygdala responds in a very aggressive way with your fight, flight, and freeze thing. And if you in that particular moment, if you know how to relax, and you learn through counseling also these breathing exercises, mindfulness, and yoga also is all about calming yourself down and having your feelings and thoughts aligned. So once you learn all that, in that particular moment you can do that. And also the easiest way that I can tell them that in that particular moment, the first aid kind of a thing is to uh, do deep breathing, maybe 3 times. Inhale, exhale, and after that, count 1 to 10 and backwards 10 to 1. And generally, it helps you calm down to that extent that you can start thinking a little bit rationally, and you're able to make a logical decision in that moment. And then there is a stress management, and obviously stress management can be easily done if you get a little bit organized, you form a routine. And this is obviously, this comes under the long term now, when we are dealing with anxiety, that if you're scared or fearful of deadlines or those kind of things at work, or you're not organized, you can't meet the goals that you have set for yourself, then it's better to start making priority lists and prioritize everything. Make a list, and also make a routine. Have a routine for yourself. And then keeping a journal is very important, because that will give you an insight to what is happening. It's very, very important to not only understand what are your triggers, but why are those triggers doing that to you, that you become so anxious or you go in the panic mode. Because once you understand why it's happening, only then you'll be able to benefit from the treatment. Exercise is wonderful because it provides you with endorphins, and it makes you feel good. It may improves your self-esteem. And the most important thing, although it's at the very end in this list, but I always tell my clients to have a very strong support system. So reach out to people. Never be hesitant, reluctant, or feel ashamed of reaching out to people for help, because it is very vital in these situations. And if you have a strong bonding with your family or one or two family members or your friends, I mean, that would be a great, huge help for you in this situation. And sometimes people don't have that kind of a support. And I came to know that there are locally support group services are available. So one can look for them, research a little bit what is locally available, and you can join those groups, and there can be people in the same boat as you are. And that can be very, very helpful in coping with the anxiety or the panic attacks. And also in self-help comes to understand that sleep and nutrition, two things are very, very important. And nutrition is very important, what you are taking in your body, because again, whatever you eat, however you eat, is affecting you. So caffeinated drinks should be totally avoided, because they make you more jittery, more nervous. And also any kind of herbal remedies or things taken just over the counter, you don't know what the ingredients are. You have to be very, very careful. Have a very healthy diet, and also make sure that you get enough sleep so that you're well rested and relaxed. And also people in anxiety sometimes start self-medicating, and they feel that okay, taking alcohol or cannabis or recreational drugs can relax you, because the first thing that happens when you take such things is relaxation, but then after effect is the anxiety worsens. It makes you more jittery, more anxious. So these are the self-help tips. If Dr. Arthur, you want to add something to these lists or say something about.
Sure, yeah, absolutely. I think it's a great list, Dr. Hassan. I would just like to mention that reducing intake of sugars or artificial sweeteners is also very important. Especially the Western diet, we have excessive amounts of sugar in our diet, and we know through research that the more sugar that you have intake, the more it's linked to behavioral disturbances.
Right.
Because refined sugar, it helps you in a very short energy spike, but then you have a crash, and when you have that crash, you go through things like withdrawal and anxiety related to your body just not having enough nutrition at the right time.
Yeah.
But I think it's a great list.
And that's very important. I mean, sugar, definitely the intake should be lessened. And so the treatment that normally in counseling, what we do is the cognitive behavior therapy and exposure therapy. Exposure therapy is very restricted therapy. First, we do the cognitive behavior therapy, in which we identify the triggers which are specific to each and every client that comes in. So what are the triggers that are creating this kind of a thought process and then the emotions in that person? And once they understand what are the triggers, then we become we work on getting aware of the thought patterns, because there is a specific thought pattern that is going to be there for each and every client. So in a certain kind of a situation with a certain trigger, that person thinks in a certain way, and it can depend on their life experiences, on their surroundings, etc. I mean, how they've been brought up, what's happening in their life at that particular moment. So once we identify the thought patterns, it's easier for us to intervene there and get them a different perspective or give them options to change that thought pattern. So what's happening is that the triggers are creating a certain thought process, and then the thought process is creating certain feelings, and those feelings are then manifesting in the behavior that the person has, and the person's behavior can be such that it again gets them into more anxiety. So the vicious cycle keeps on going, and the whole objective of this cognitive behavior therapy is to break that vicious cycle. And we can do it at that where the thoughts are coming in. And that's why mindfulness helps a lot to understand how we can differentiate between the thoughts and the feelings. And how the certain thoughts are producing certain feelings which might not be exactly aligned with the, you would say, or relevant to the thought, because sometimes we feel in our thought, the thought comes that we are hungry, but when we drink water we feel, oh, we were actually thirsty and we don't feel like eating at this time. So those kind of things, very subtle things, are there that can differentiate the thought from the feeling. And once that has been improved and evolved, then automatically their behavior, their outcome changes, and anxiety is reduced. And what we do in exposure therapy is that once we talk to the person who comes in with a certain kind of anxiety provoking situation, we kind of relax. Once he's relaxed and comfortable, then we gradually expose them to that trigger, because a lot of youth, they are scared of presentations in the class, and they come and they say that they get panic attack if they have to stand up in front of so many people and present something. And that happens with people in jobs also, where they have to present in front of huge crowd. So what we do is that we start first talking to them about that what if you are there standing, imagine. And gradually with that, we combine the relaxation exercises, make them imagine that they are presenting in front of people, and deal with the anxiety symptoms in that counseling session. And then we tell them to start doing it in front of people that they are comfortable with. Maybe in front of the friends, they can do a mock session of that presentation, or in front of their family. And then gradually we tell them to go and do it, maybe in the office with people that you don't know, and then go on a bigger stage and present to so many people. So it's always a gradual process of exposure, which is done under strict supervision. And these are the things which we use in counseling. And then definitely There are a lot of situations as far as anxiety is concerned where medication is needed. So, Dr. Athar, if you can elaborate on this.
Yeah, sure. I think, in general, we view medication as a more um, severe case. We try always with therapy, psychotherapy first, like the all the exposure therapy and CBT that Dr. Hassan was just talking about. But if someone is not getting enough benefit from exposure therapy and CBT, and it is impacting their life to the extent that their relationships, their work is suffering, and especially if that person is so anxious that they are suffering from suicidal thoughts, then it is time to use medication. The thing that people get very anxious about with anxiety medication, it's kind of funny to be anxious about anxiety medication, but there are some anxiety medications which are addictive, and there are many that are non-addictive. So when I see my patients, then I kind of try to assess their history of trouble with addiction first and foremost. And I also assess how severe their anxiety is and how quickly they need relief. So, for example, the best treatment for someone who suffers from a panic disorder, which is when someone has panic attacks randomly and is scared of having another panic attack in a public place, the best medication for that on a short-term basis is a benzodiazepine like Ativan. But a benzodiazepine is an addictive medication, so it should always be used only under the guidance of a doctor, especially a psychiatrist if one is available, and it should be used sparingly. The other reason to use addictive medications in anxiety is just for short-term relief until non-addictive medications can take effect. And what I mean by that is that if someone is suffering extremely from anxiety, then the non-addictive medications, which would be like the SSRIs, that will take time to take effect. It will usually take at least 2 to 3 weeks, up to a month to really take effect. And in the meantime, they can use the Ativan, the Xanax, which are benzodiazepines, to help with the anxiety that they're experiencing. So those are some of the different medications that are used. And people also ask about side effects to medications, which is important to discuss. So the main side effect of the benzodiazepines like Xanax, Klonopin, Ativan is that they are addictive medications. They can affect your ability to drive because of grogginess. They can also affect your memory. With the SSRIs, which are the non-addictive class, much safer, the side effects are much milder and they won't affect your memory. They are not addictive. They, usually just affect things like nausea for a few days. Some of my patients have nausea for a long time with these medications, so I have to use another strategy. But the side effects are generally tolerable for the majority of the public. So in summary, I would say that it's time to use medication when therapy techniques are not enough and it's impacting your life severely, your work, your relationships, and you are having severe symptoms to the point where life just seems like it's just not worth living. And, I never want anyone to experience something like that. It's a very dark place to be in. But unfortunately, there are a lot of people who suffer from anxiety and who suffer from undiagnosed anxiety. So I'm glad to be doing this with Dr. Hassan and be able to collaborate to spread awareness of these conditions. And I really appreciate the time, Dr. Hassan.
Thank you so much, Osman, and thank you for your time as well. It's just that I feel that anxiety is such a common thing that we all experience, but sometimes we are at a loss when to seek help and when it is normal. And sometimes, even when it is normal, some people feel that we should not be having it. It's some kind of a defective feeling that we are having and we need to get rid of it. But this is what I wanted to bring in, that it's not always something detrimental. It can become one when it goes beyond a certain level and it makes you dysfunctional. You're not able to function. And I think that, what you mentioned, that combining the two, medication and therapy, can be very, very beneficial for the person, because medication can also be used initially when the person comes in and he has very heightened anxiety, and he can't deal with it, and he can't sleep, he can't eat properly, his whole life is affected by it. So he can use it for short term and combine it with therapy, and then once he gets to that, everything calms down, and he can then just stop taking the medication and then continue with the therapy. Also, I wanted to ask you that how do we take the medication? I mean, like, obviously under the supervision, but nobody should be stopping it abruptly, is it? So we normally, it's recommended that you wean it off.
It depends on the medication, but yeah, for most of the anti-anxiety medications, you do need to wean them. And it's something that you should discuss closely with your psychiatrist or general doctor. But in general, the benzos, like the Ativan, Klonopin, Xanax, those medications should never be stopped abruptly because they can lead to very severe symptoms and withdrawal. But most of the SSRIs like Prozac or Zoloft or Paxil, some of them are safe to stop immediately, and some of them you have to wean gradually. So it just depends. But especially like the addictive class of medications like Xanax, you should not abruptly stop taking them at any time.
And I've also seen, I mean, a lot of clients that I see that sometimes they are, and it comes under, I think, abuse of the medication, that they take it when they feel like taking it, and they stop whenever they feel like stopping it. And
Right.
that leads them to then seeking help from a rehab. Which is a very sad thing, because I think that once they go to a psychiatrist and they tell them to take certain medication and it benefits them, there is some kind of a slackness that they don't go back, and they don't get the recommended feedback from the psychiatrist that what are we supposed to do now that we are feeling better. Should we just stop it, or should we continue, or we can do it as we feel
Mhm.
it, the taking it. So I mean, I don't know, I mean, there is a lot of confusion, because I don't know that, I think in that aspect also we need to psychoeducate people on medications of psychological mental health issues, because people feel that stop, and whenever they feel like they can take whenever they feel like, but they have to be very, very careful and seek professional help.
Absolutely. I think it's important that, to follow the directions of your doctor. And, they do want what's best with you. Most of us in medical mental health, we enter this profession because we want to help people, and we're not trying to hurt you. We are simply trying to find solutions for you, and we work with the patients. It is very common, like Dr. Hassan said, for my patients to have an initial appointment and they never show up again, and I don't know what happened to them, and I can't really track them down or chase them. It's the responsibility of the patient to keep me informed and to tell me what's going on in their life, and how I can help them further. But generally speaking, when I start a new patient on a medication, I would like to see them within 2 weeks or a month, to check on them, and then we can decide further how often we need to see each other and if we need to adjust the medications. But it's a relationship you have with your doctor, and it's a two-way relationship. It's not that I'm telling you exactly how you should behave. You inform me what you want, and we work together to reach your goals, to live a more satisfactory life.
Exactly. And I think that's where the therapist role also comes in, because the therapist can talk about compliance with medicine. The therapist can, whatever the problems in the behavior are, they also, you can see in reflect in taking the medication or stopping the medication or not
Mhm.
psychiatrist. So we therapists do deal with the behavior, and why they are not going, or why they are not keeping that contact, kind of a thing, and to encourage them to do that. Also, before we wrap it up, I would really like to mention that people are actually very scared of the side effects of antipsychotic medication, and they feel that the side effects that they always talk about are very scary for them. And I would say that there are side effects, but then chemotherapy has side effects as well. So when we are treating cancer or other diseases, we are taking even simple painkiller has side effect. It can upset your stomach, or there are so many medications that have very overt side effects, but we do take it because we somehow we have been tuned now that it's okay to take them. But here, because of the stigma also associated with mental health, plus the medications that we are taking, people don't understand that maybe they are going to do something negative. There can be a negative effect rather than a positive, but they need to understand that the side effects are exactly the same thing as when if you're taking something for cancer and there are side effects, and you go through all that to get healed, to improve your health and get better. So I think
Yes.
that you want to say anything, Dr. Arthur? You can go ahead.
Oh no, I'm sorry to cut you off. I just said I agree. It's important to look at side effects as something that may happen. It happens in a lot of people, but it's kind of like a risk-benefit analysis that you have to do. The
Yes.
side effects are often much more easy to deal with than the disease. And, we also are going to work with you, the mental health professionals, to examine your side effects to see if there's a better medication for you, and something that suits you better. It's not going to be like you are just going to suffer, and the psychiatrist is experimenting on you and is like a pill pusher, like all these popular misconceptions. So we will work with you. We want to understand what's important to you. For example, some of the medications that I offer patients can lead to weight gain.
Mhm.
So if I have a patient who's already obese, then I'm not going to offer them that medication. And I will talk to that patient about their goals, about their body image, about what's important to them at that moment. Um, so it's always good to have good communication with the people taking care of you and to seek help. I think that's what both of us really want to stress, that
Yes.
it's important to seek help. It's important to normalize these conditions like anxiety and depression and mental illness in general. And so that would be a good takeaway.
Yes, definitely. And I think this is where we wrap up our today's discussion. And I think we have a question. Do people become reliant on taking medication for coping with anxiety and depression, or is there a method when they are prescribed to help them get into a better mindset without relying on medication?
So my answer to that would be it depends on the medication that they're taking. So if anybody takes the class like the benzo medications that I mentioned,
Mhm.
especially Xanax, then a lot of people, if they take it for months and months, they do become dependent on these medications to survive, basically. And that's why, in general, my practice is to not offer those medications for more than 2 weeks to anybody. It's only for very severe cases. The other medications, the SSRIs that I was talking about that help increase serotonin in your brain, those are not addictive, and they're not something that you will have to depend on. There are a lot of people who need these medications after going through a severe stressful event. And then after 6 to 9 months, they're able to get off of the medicine and be healthy, for the rest of their life. In general, what we teach in psychiatry is that if someone has severe anxiety and they've had 3 episodes of severe anxiety or depression to the point where they may have to be hospitalized or have to seek medical treatment, then it's a good idea to take medication for life. But that's also a discussion that you would need to have with a doctor.
I think the key factor here is to be open with your, have a communication with your doctor, with your psychiatrist, and
Mhm.
there is no harm in having an open discussion, because that will benefit you. And people, because of the stigma associated with it, I think people feel a lot of anxiety even discussing it. the same thing, what if we are told that we have to take it forever, or this is not curable, or things like that. But the thing is that you are improving your quality of life because you are improving the problem. You are kind of, getting the treatment for it. So I think open communication, discussion with the psychiatrist or the therapist is very important. And another question coming is that associated, I think, with the same one is that, is there any role of non-pharmacological therapy?
Yes, absolutely. There is a role. The first thing that I would like to start with is the stress reduction exercises that Dr. Hassan was talking about. There's a really good one that I like that's called progressive muscle relaxation, where you are tensing and relaxing different muscles of your body in order to reach a more relaxed state. I
Right.
also strongly believe in spirituality and religion to help with anxiety and depression. And that's something that we're going to discuss further. But just as a quick tip, something that I tell people who are Muslim, who are open to it, is that if you do read a lot of durood, it's very helpful for anxiety. So reading Allahumma salli ala Sayyidina Muhammad as much as possible, it helps with feelings of anxiety and dread. And that's something that a lot of spiritual masters have taught their students. The other thing is that there are some herbal remedies that can help with anxiety. Um, and the biggest one that I like to tell people about is something called St. John's wort. And if you have any questions about that, just feel free to message me or contact me on my Facebook, and I can explain more. But St. John's wort is a natural herb. It's a flower that people can use for anxiety, and the only downside is that it does interact with a lot of medication. So it's important, as again, to talk to someone about it before you start it, yeah, especially like a psychiatrist. But there are herbal remedies for these conditions as well.
Wonderful. So I think that's a great insight into, you talked about the spirituality aspect as well, which is very important. And inshallah, we'll be doing a full Zoom session on that. So there is another question. What are the signs of anxiety that tell a person that it's time to seek help? And I would say that when it's interfering with the normal functioning of that individual, if that person is not able to carry out the normal chores of life, or their daily life is affected, their sleep is affected, they can't sleep, their eating habits are affected, also they can't meet the deadlines, and they are so anxious that they kind of avoid, then they start avoiding certain situations. Somebody gets scared of driving, then they're not driving, so they can't go to their work, so they can be fired from the work, or they have to drive to the school, but they are not. So wherever in whichever aspect of your life you feel that now you have started to kind of avoid certain normal life situations because of your anxiety, then it's time to seek help in that moment. So I think it's almost time. Also, we don't have any more questions, so we can wrap up. And I think we can just little bit, if we have to put it all in a gist, that we have to understand the triggers that are making us anxious, and then we have to understand what are the thoughts that start coming up in our head when certain triggers happen, and that will help you deal with why those triggers are creating these kind of thoughts in you, or those kind of fear in you. And from there onwards, you can see that, okay, after I get these thoughts, what happens? I start, my palms start to sweat, I have all these physical aspects, I feel numbness in the extremities, or whatever, palpitations, heart rate increases. So then you can kind of figure out that, okay, these thoughts are creating these feelings, and then I behave in this way. Only then we can go back and interrupt that vicious cycle, and kind of start, the treatment can be effective once we understand that what are those thought processes that make you uh, manifest a certain behavior. I thought there was a question, but there's no more question. And I would also wrap up with a quote that people can then, think about it. And it's from Oscar Wilde. He says that I don't want to be at the mercy of my emotions. I want to use them, to enjoy them, and dominate them. I don't want to be at the mercy of my emotions. I want to use them, to enjoy them, and dominate them. So hopefully, once we figure out our own vulnerabilities and insecurities and where we need to work on, and we can for that seek help from a professional. Certain things, as we mentioned in the slides, we can do, which is a self-help, become more aware of our surroundings, of our own feelings, emotions, and also of what we are eating and how we are leading, what is our lifestyle, it's healthy or not, so we can improve a lot in that aspect. So just one more comment from one of the participants, that I agree the differentiation between our thoughts and feelings is very important. So thank you everyone for joining in. Thank you so much, Dr. Athar, for your time. And inshallah,
Thank you.
having another session, the third one with you soon. And stay safe, everyone.
Um,
Enjoy your week and have a great time. Thank you. Khudafis.
Thank you. Allah Hafiz. Allah Hafiz.